88 says deadly bone cancer. Answer is osteo. Remember, osteo is bone, and it's a sarcoma. 89. 89 says covers the shaft. Remember the shaft on the first diagram I did for you today is what showed this region right here. So if this was the shaft, just to kind of refresh your recollection as when I began this lecture, if this was the shaft or diaphysis, this covering of the diaphysis is called the periosteum. Okay, covers the shaft, that's your periosteum. Remember, that's going to be connective tissue. Remember, all connective tissue comes from mesoderm. Number 90. Number 90 says lines the marrow cavity. Remember I said the marrow cavity was sitting here inside of the shaft, and therefore that's the endosteum. Remember, endosteum also is mesoderm, so therefore it's a mesodermal germ layer. Number 91. Number 91 says the cartilage cell. Remember, cell is always site. Cartilage is the word chondro, so it's a chondrocyte. 92. 92, where the saddle joint formed. You know, if you take a look at your thumb, you notice that it's kind of forming a saddle where it comes together. Because remember, the thumb is going to be a carpal metacarpal joint. So this, when I'm doing this with my wrist, I'm actually moving down here. This is my wrist, so this is my carpus where my pen is. This is going to be my metacarpus, so that's a metacarpal joint. So it says, where am I going to find this saddle joint? And that's going to be on the thumb. And remember, the thumb is really called the pollex. 93. 93 says the cheekbone. Cheekbone's got a couple different names for it. You know, you kind of look and say, this is my cheek. Well, my cheek is called my malar bone, but it's also called the zygomatic bone. And sometimes this is called the zygoma or the zygoma region. 94. 94 says shaft. Remember, we've already talked about shaft. That's the diaphysis of the long bone. 95. 95 says end. That's the epiphysis. 96. 96 says shaft cavity. Remember, that's sitting up here again. That's your marrow. But another name for it would be the medullary cavity. Remember, that's going to contain my yellow marrow or my fat. What's the significance of knowing that? Person breaks their femur. When they break their femur, they end up at the hospital and they say, well, there's a lot of swelling. Let's send you home. Let's wait till the swelling goes down a little bit so we can get a better x-ray. Problem is, those fat cells or adipose cells that are sitting inside of that marrow-medullary cavity can go into the venous circulation, and the following morning when you don't show up for your appointment, the answer is you're dead. And what did you die of? You died of a fat embolism. A piece of that fat from the yellow marrow went into the venous circuit, went to your heart and lungs, and died. So kind of think there's always a significance of something. 97. 97 says lines. Remember, lines or covers. Remember, that's going to be the word epithelium. 98. 98 says shin bone. Remember, shin bone? You kicked your shin. What bone did you actually hit? You actually hit your tibia. 98. 99. Kneecap. Well, remember the kneecap. People look at the kneecap and don't understand. Well, first thing, it's unarticulated. Unarticulated means it does not directly attach to another bone. But the other thing is, what's the importance of it? Well, the importance of it is it's called a tendon bone. And that reason is because it stabilizes the tendons of the quads. And as we go into muscle, we're going to start learning about the quads, and the quads are going to comprise of the rectus femoris and then the vastus lateralis, medialis, intermedius. But this unarticulated bone, and sits in the appendicular skeleton, there's two of them. It kind of looks like a sesame seed shape, and sometimes it's also called a sesamoid bone. So just think of the patella as being a tendon bone, a sesamoid bone, and significant stabilizing the tendons of the quads. And I would say another thing to remember at this point is the quads are the anterior, which means they're in the front, leg extenders. So when I walk, I actually need my kneecap. 100. 100 says bone builder. That's an osteoblast. So that's what would make a bone tumor. Because blast cells are mitotic, a bone tumor comes from osteoblast cells that are out of control or uncontrolled mitosis. 101 says bone remodeler. Remember, I've got to constantly replace bones. Some people say that every 8 years, every bone cell's been replaced. So therefore, that's an osteoclast. Osteoclasts eat away at osteocytes, and they raise my serum calcium. But when I eat away an osteocyte, I develop osteoporosis or osteopenia. So that's why it's so significant. Basically, when you look at the female population, when their estrogen levels deplete, but you also look at the black population. Why? Because the black population don't absorb vitamin D3 cholecalciferol, and therefore you could have a female black woman and she may not have an estrogen level depletion as a light colored woman, but she may have a problem because she's not getting enough D3, she can't absorb calcium, and as a result she's got severe osteoporosis or osteopenia. 102 says lateral ankle bump. When you think of your lateral ankle bump, it's that bump when you feel down on the side of your ankle. So that's called a lateral malleolus. 103 says the medial ankle bump. Well, that's just a medial malleolus. So those actually are processes of the tibia and fibula. They are not actually ankle bones. They're ankle bumps, because they're not bumps or processes of the ankle bones or the tarsal bones. They're just processes of the tibia and fibula, which are the leg bones. 104, the inferior breastbone process. Just think of the breastbone. So here's my sternum. This is going to be my jugular notch or suprasternal notch. I'm always going to think of 2 fingers above that is where I put a hole for a tracheotomy. This is going to be my xiphoid process. So when 104 says the inferior breastbone process, that's the xiphoid process. Significance, that's what you're going to break in CPR. Is it important? No, because what it will do is actually fibrose down. It's actually really one of the origins of the diaphragm when we talk about muscles. 105 is the superior breastbone process. Well, that's your jugular notch or suprasternal notch. Okay? So if you feel at the top of your neck right here, you can kind of feel a V-like indentation. That's going to be your suprasternal notch. If I asked to say that, gee, I needed to put an emergency trach tube in because something was closing up my airway, I would just take 2 fingers above that notch, and that's how I would insert an endotracheal tube. So that's how I would put in a tube in. So remember, an endotracheal tube would be going down my mouth, but here I do a tracheotomy tube so I could go directly in, because I couldn't get an endotracheal tube in because there's some type of obstruction or possibly burn, some kind of a burn injury. 106 says handle of the dagger. Well, you know, the top of the sternum is here. It looks like a dagger if you look at it, so it's called the manubrium. Manubrium, handle of the dagger. 107 says the number of ribs. We know that there's 7 pair of ribs, 7 pair of true, and there's 3 pair of false, and there's 2 pair of floating. So 7, 3 is 10, and 2 is 12. So the total number is that times 2. So therefore I have 24 ribs, or 12 pair. Number 108 says that large thigh muscle attachers again, looking at the femur here, I can see that my thigh muscles are going to attach to these 2 processes. This is that lesser trochanter. This is the greater trochanter. Remember, this is the proximal lateral femoral process. This is the proximal medial femoral process. And therefore, those are the large muscle attachment points. So therefore, on question 108, the answer to that is the greater and lesser trochanters. 109. 109 says the number of phalanges. Remember, when you're looking at your hand, you know you've got 3 phalanges here. So my little finger, or my digiti minimi, has got a proximal, medial, and distal. That's 3. I've got my second finger, proximal, medial, distal. That's 3 more. I've got my third finger, proximal, medial, distal. That's 3 more. I've got my index finger, 1, 2, 3, 3 more. And I got my thumb, or my pollex, is 2. So 4 times 3 is 12, and 2 is 14. So 109 says the number of phalanges. Well, if I've got 14 on one hand and I've got 2 hands, so the answer is I've got 28 phalanges. Okay? Now, 28 phalanges now are going to be on my hand, but this doesn't say the number of phalanges just on my hand. This says the total number of phalanges. So if I've got 28 phalanges on my hands, and I look at my foot, I'm going to notice that I've got 2 phalanges on my big toe, or my hallux, or great toe, and each of my other toes have 3 phalanges, and same thing, so I've got 28 phalanges there, so 28 phalanges on the foot, or the toes, and 28 and 28 is 56. So in effect, I have 56 phalanges, 14 on each hand, and 14 on each foot, and since 14 is going to be 28 times 2 is 56. 110 is the wrist. Remember, wrist is called the carpus. 111, remember, that's going to be comprised of 8 bones. 111 says the ankle, that's the tarsus. Tarsus is going to be comprised of 7 bones. 112, WBC, that's a white blood cell. Remember, a white blood cell is a leukocyte. Always think of the magic number of 6 to 10,000 per cubic millimeter. 113. 113 says a low red count. Low red count, probably the easiest answer to remember, is anemia. Okay? But another way of saying it, because you remember there's always more than one way to say the same thing, would be erythrocytopenia. So depending on, what course you're taking or what specialty you're going to, people may say someone is anemic But if you were talking to someone as a hematologist, he may say, well, the person is erythrocytopenic. So it's just two different ways of saying the same thing. So that's 113. 114 says most numerous formed element. Remember, that's a red blood cell or an erythrocyte. Remember those magic numbers of 3.7 to 5.5 for a female, and 4.5 to 6 for a male. And again, remember, those are million per cubic millimeter. 115. 115 says little finger touches your thumb. If I take my hand and I take my little finger and touch the two together, that's opposition. So the reason I'm able to do that, have an opposable thumb, is the thing of opposition. 116. 116 says circumduction. We've already talked about that. Remember, that's flex, extend, adduct, abduct. I told you that we do that at the hip joint, we do that at the shoulder joint, and we do it at the thumb. 117 says towards the midline. That could be medial. Another one would be abduct. Adduct. Number add 2. Number 118, it says towards the head. Well, one answer could be cephalic, or it could be superior. 119. 119 says towards the feet. There's where we could use the word caudal or inferior. When we get to the nervous system, we're going to talk about the free-floating nerve roots. They're going to be down pretty well after the spinal cord is. If you think the spinal cord is really only around 18 inches long, I've got free-floating nerve roots called the cauda equina. Cauda stands for the horse's tail, so that's where that word caudal comes from. So when you think inferior, it's going to be caudal or below. 120. 120 says digiti minimi forearm bone. If you look at your digiti minimi or your little finger and you trace it back, you'll see that the little finger bone below the little finger is going to be the ulna. 121, it says the pollex forearm bone. Well, pollex is your thumb. If your pollex is your thumb and you trace your thumb up your forearm, you're going to see that you're going to be on the radius. So if you wanted to take a radial pulse of someone, what you would do is just look at their thumb side, and that area right here is where I'd find my radial pulse. Okay? My radius is here, my ulna is over here, my thumb is over here, my little finger is over here. Okay? 122. 122 says turn the plantar inward. Well, you know, the plantar surface of my foot is the bottom of my foot. So if I take my plantar surface and literally, if you look down at your feet and cause it to look inward, that means your soles are actually looking at one another. So when I turn my plantar surface of my foot inward, it's called inversion. So it's real easy to remember that. Inward inversion. Okay? I'm inverting my foot. My soles are touching one another. 123 says turn plantar outward. Well, if I take the bottom of my foot now and I put it on the side, now my plantar surface is facing lateral. My plantar faces lateral, it's going to be called eversion. Now the significance of that is, think about someone that's got a bad hip. And you could probably spend, $3,500 for an MRI or CT scan. But if I have a bad hip, I'm going to see that I'm going to literally be walking on the medial aspect of my shoes. So when I look at the shoes, I'm going to notice that the sole of the shoe is worn on the medial aspect, and that'll tell me the person probably has a bad hip. So kind of think of the significance of just saying, hey, rather than sending you for a $3,500 MRI or CT, just have the person walk, and as they walk away and towards you, and you take a look at their shoes, you'll be able to tell whether there is something wrong with that hip socket. 124 says number of cervical vertebrae, and the answer is 7 cervical vertebrae. Remember that C1, or the first cervical vertebrae, is the atlas. Remember that the second cervical vertebra is the axis. And the significance there to remember is it's that axis that has that process called the dens. And the dens is what attaches that C2 or atlas to the axis and allows your head to rotate. So just kind of think that that fully movable joint, be called the atlantoaxial joint, is that joint between the atlas and the axis. And I'll just draw it again to show you. If this bone up here is the occipital bone, and the occipital bone has sitting below it the occipital condyles, and if I take this skull right here and just lay it here, I can see that these red marks are actually the occipital condyles. And what's going to articulate on those occipital condyles is going to be the first cervical vertebra. So kind of think what my fingers are doing is what the atlas would be doing. It's going to allow me to flex and extend my head. Okay? So that's why, but that's a joint between the axial skeleton, right, up here. It's an axial joint, but that's between the cranial bone and the vertebrae. Okay? Now, below that, occipital condyles is going to be the atlas. So that's where I'm going to have the movement of flex and extend. But if I go from the atlas, I'm going to have the other bone below that called the axis. And the axis is going to have this process called the dens. So that vertebrae kind of looks like this with the superior facing process. And so kind of think that what it's doing is allowing my head to rotate. So this joint here is going to allow for rotation. That's why this one up here is going to be called the atlanto-occipital joint. And this joint down here is going to be called the atlanto-axial joint. Both of those are diarthrotic joints. Number 125 says the number of thoracic vertebrae. And of course, whenever you think thoracic vertebrae, the easy way to remember that is that since I've got 12 pair of ribs, I've got 12 thoracic vertebrae, so the answer is 12. Not 12 pair, but 12 vertebrae. Number 126. Number 126 is old age arthritis. That's going to be called osteoarthritis. So just think the difference there is old age or injury is going to be osteo. 127, what you sit on. Remember, you're not sitting on your coccyx, you're sitting on your ischium, and actually the processes of your ischium, which are your ischial tuberosities. 128 tailbone, that's your coccyx. Remember, that's going to be 4 fused coccygeal vertebrae. Oftentimes people slip, they fall and break their coccyx. The answer, is it significant? No, it probably will heal and fibrose together. The only concern that might be have is because of the muscles down there in that region, and that when someone has defecation issues they might have, it could cause pain. It also could cause trouble with the way the sphincter opens because of the coccygeal vertebrae down there and the attachment of the muscles. 129 says os coxae. Remember, os coxae was really one ilium, one ischium, and one pubic bone. So therefore, the os coxae was the old name for one ilium, one ischium, and one pubic or pubic bone or pubis bone. Number 130 says two parts of the hypophysis. Remember, the hypophysis is the pituitary gland. I've got the anterior pituitary and the posterior pituitary. Anterior is the adenohypophysis. Posterior is the neurohypophysis. 131. Big toe. Well, the big toe is called the hallux. Another name is called the great toe. 132. Uric acid and 131. When I get an accumulation of uric acid in my hallux, it's a classic symptom of gout or gouty arthritis. It's classically given from, I always think of course, is that your excess by your meal, you're drinking beer, too much purines and pyrimidines, it causes an inflammation, and generally it can be inflammation several places, but the classic place of inflammation is actually in the big toe or the great toe. The way to treat it is actually colchicine, and then colchicine with allopurinol. Colchicine will be the immediate way to treat it, and allopurinol you would take as a drug to control the gout or the gouty arthritis. 133 is the away from the midline. Well, that's going to be, naturally, it's going to, the abduction is away from the midline, or it could be lateral. 134 is the C1, C2 joint. We just talked about that. That's the atlantoaxial. That's that joint that the dens is going to allow me to rotate my head from side to side, using the dens as a process, also allowing for what's called a diarthrotic joint or fully movable. 135 is where the manubrium is. Remember, it's the top portion of the sternum. It has that process called the jugular notch or suprasternal notch, which is a landmark for a tracheotomy using two fingers above it. 136, standing on my toes. When I stand on my toes, it's called plantar flexion. Always think of a ballerina stands on her toes. 137. 137, standing on my heels. That's called dorsiflexion. When I'm in the anatomical position, I'm actually dorsiflexing. 138 forms the palm. The palm of my hand is formed by my metacarpals. Remember, there's 5 metacarpals in each hand. 139 is the two types of ossification. There's endochondral, which means inside cartilage, and there's intramembranous. Endochondral, most of my bones. Intramembranous, I'm always going to think of skull bones and facial bones. Why is that significant? Because oftentimes, especially in females, you notice that the cheekbones in that don't get to their final resting place till about 23 or 24 years of age. So a lot of times a person, especially the female, changes quite a bit in their facial features between maybe the ages of 16 and 22 or 23. Number 140. 140 is the two types of I'm sorry, I missed one. That is 140 that I did here. So this is 139. And since 139 forms the arch is going to be my metatarsals. So remember, metatarsals is going to be 5 of those. So just make sure you make that correction. 139 is my metatarsals, 138 is my metacarpals, and then 140 are the two types of ossification. 141 is the type of ossification in skull bones. I just said that. That's going to be intramembranous. 142 is a type in most bones. Answer is going to be endochondral within a cartilage model. 143, it says what the patella does. We've already discussed that. It stabilizes the tendons of the quads. So when I extend my leg, this is going to stabilize those muscles that are going to extend my leg and cross over the top of the patella. Remember those quads used to have the quadriceps femoris. As we get to muscles, we'll talk about that being the rectus femoris, and of course also the vastus lateralis, medialis, and intermedius. 144. Where is red marrow found? Well, the answer that we usually use is going to be in the trabeculae of spongy bone. So when I drew the diagram of a long bone, those trabeculae that were inside the spongier cancellous bone is where I'd find my red marrow. But as we age, we tend to really only have some marrow left in my iliac crest and in the rib cage and that. So that's why when someone needs a bone marrow aspirate, if they're going to donate bone marrow, they would probably drill holes somewhere near the top of the iliac crest. 145. 145 is what myeloid tissue produces. Well, myeloid is another name for marrow, so therefore that's going to produce my formed elements. And of course, remember, formed elements are red blood cells, white blood cells, and platelets. Now we go to 146. 146 says hemopoiesis. Remember, hemo is blood. Poiesis is the production or creation of. So that is blood cell formation. Remember, blood cell formation is going to be production of erythrocytes, leukocytes, and thrombocytes. If you said erythropoiesis, that's red blood cell production. If you said thrombopoiesis, that's going to be platelet production. If you said leukopoiesis, that's going to be white blood cell production. So it's really significant to remember suffixes and prefixes in any type of allied health profession. 148 says germ layer of bone. We've already talked about that as being mesoderm. 149, germ layer of cartilage, same thing, mesoderm. 150, describe anatomical position. Remember, in the anatomical position, you stand upright. You're going to stand on your heels. You're going to be basically your front of your hand, so your palms are facing forward. So just remember, in the anatomical position, I'm describing my palms facing forward. Why could that really be an issue if you think very simply? Well, if you started thinking about someone that had a hand injury, and you said, well, when I described it, I was thinking, was it on the this side or this side? Well, in the anatomical position, remember, this is the anterior surface of the body. So the palm of the hand is anterior, and therefore the radius is the anterior bone of the forearm. The ulna is the anterior form of the forearm. But if I was to mistakenly talk in this direction and started looking at my bones, it'd be backwards, because I would be thinking the radius is medial. So just remember, in the anatomical position, the radius is lateral. Thumb is lateral in anatomical position. The radius is lateral in anatomical position. Pollex is medial in anatomical position. Ulna is medial in anatomical position. 151. 151 says shin bone. Again, shin, when you hit your shin, what bone is that? That's the tibia. It's got a very thin muscle we're going to talk about when we get to muscles called the tibialis anterior. That's why oftentimes when you hit your shin on something, you have this horrible pain and swelling, because there's really only one principal muscle there sitting on the front. 152, another name for the outer ear. You know, if you think of my outer ear, I'm thinking my outer ear is called the pinna. But another name for it is the auricle. So depending on what your specialty you're going into, it's either called the outer ear or the pinna or the auricle. The name auricle actually goes back to old, probably anatomy books of the heart, because the auricles of the heart are the kind of ear-like flaps that we find on the heart. 153 covers the diaphysis. Remember, diaphysis is covered by the periosteum. 154. 154, immovable. We're talking about an immovable joint. That's going to be synarthrotic. Remember, I think the best example is going to be a suture. 155. 155, slightly movable. That's, again, amphiarthrotic. I gave you examples of that. The pubic symphysis is an amphiarthrotic joint. Most of the joints of the vertebrae going down from C2 all the way down to the sacrum are amphiarthrotic, allowing for lateral flexion. 156. 156 is fully movable. That's diarthrotic. Remember, that's fully movable. That's going to be most of the joints of the body. Because just think of your hands alone. Each of these joints in my hand is fully movable. So I've got a interphalangeal joint, 1, 2, 3 interphalangeal joints here, 3, 3, 3, 3, and 2. I've got 14 just on one hand. So that's going to be the most common type of joint. 157, most common, so 155 is slightly movable, 156 is fully movable, 157 is most common diarthrotic again, so it's the same answer. 158, what joins the iliac bones to the axis? Well, think of where the iliac bones join the axis. That's going to be the sacroiliac joint. 159. 159, the wristband. You know, when you look at your wrist, sometimes people get carpal tunnel syndrome, which is compression of the medial nerve. But there's a retinaculum, or a broad flat sheet of connective tissue that kind of compresses that wrist and keeps those bands fairly tight. So therefore the wristband is called the retinaculum. And that is a aponeurosis. And remember, an aponeurosis is defined as a broad, flat sheet of connective tissue. So that's what loosens up when someone gets, carpal tunnel syndrome. 160 says the bone process contained in the hypophysis. Remember, the hypophysis is a pituitary. Remember, the pituitary gland sits inside of the sphenoid bone, and therefore the sphenoid bone has got that process called the sella turcica. And again, if you just look inside of the cranial vault, and I know this is the sphenoid bone because it's this bat-shaped bone, and I know the pituitary is sitting right inside of here, and as I flip this a little bit on its side, I can literally see that there's a bony process right here that's encasing the pituitary, and that's the sella turcica. Used to be called the Turkish saddle, or the saddle of the Turks, but it's just because the way it looks, the way it holds that pituitary gland in place. 161 says the bone that contains it, that's the sphenoid. So be careful when you're asked the test question. If someone said, where's the pituitary located? Well, it's located inside of the bone called the sphenoid bone, but there's a process of the sphenoid bone called the sella turcica. So always ask yourself, is it asking about the process or is it asking about the bone? 162. 162 says the type of ossification, the facial bones. Remember I said that especially in the female, we notice there's a much change between the age of 16 and 22 or 23. So therefore, those are membrane bones. That's going to be intramembranous. They're membrane bones. 163, type of ossification, the femur. Remember, the femur is a long bone. So therefore, that's going to be endochondral, inside a cartilage model. 164. 164 is type of bones in the face. Again, membrane bones. 165. 165, number of vertebrae. Well, let's count them. I've got 7 cervical. I've got 12 thoracic. I've got 5 sacral. I've got 5, I'll put 5 lumbar, 5 lumbar. I've got 5 sacral. And I've got 4 coccygeal. So 7 and 12 is 19. And 5 is 24. And 5 is 29. And 4 is 33. So in effect, I have 33 vertebrae. But what sometimes is confusing is that, remember, these vertebrae are fused here. So therefore, this sacral is fused into one thing called the sacrum. So that means it's only really one if I fuse it together. Those 4 coccygeal are fused into the coccyx, which is only 1. So it kind of changes that number a little bit. So because this originally was 5 and 4 is 9, and now you take 2 away, which is 7. So therefore 7 away from 33 is 26. So if I look at the vertebrae as the fused vertebrae of the sacrum and the coccyx, I've got 26. If I look at the vertebrae as being unfused, I've got 33. So again, it just tells you that when you take a test, you want to be very careful that you read the question. Is it asking about fused vertebrae, or is it asking about total of unfused vertebrae? 166 says where the spinal cord passes through the vertebrae, and of course that's going to be the spinal canal. 165, so this is 165, this is here. So this is spinal canal, is down here, I'll fix that. 165 is spinal canal. 166 is spinal. 165 is 33 if they're unfused, 26 if they're fused. 167. 167 says has a gel-like matrix. Remember we talked about bone. We said bone has got hydroxyapatite in compact bone. That's the bony matrix, calcium and phosphate. But what's got a gel-like matrix is cartilage. 168. 168 says covers the epiphysis. Remember that's going to be where I'm going to have a joint, so that's going to be hyaline, articular, cartilage. 169 asks the question, the number of pollex phalanges. Remember my pollex is my thumb. My thumb has only got 2 phalanges. It's got 2 thumbs, so the answer is 4. So there's 4 pollex phalanges if I count both thumbs, okay? If you said how many thumbs in one pollex, the answer would be 2. 170. 170 says the bone posterior to the ethmoid. So again, if I look inside of the cranial vault, and I've got my sphenoid bone, which is my core bone, I've got my foramen magnum, I've got my ethmoid bone sitting here. So this is frontal, this is sphenoid, this is occipital, and this is going to be ethmoid. So that's how you break questions down. So when it said what bone is posterior to the ethmoid, the answer is the sphenoid. 171. Bat-shaped bone, same thing, sphenoid bone. It looks like a bat or butterfly. 172. The bone for the tear ducts. You know, if you think about your eye, you've got what are called the lacrimal glands in the corner of your eye. If I look at this eye right here, I can see that that's my bony orbit, and basically they're very hard to see because these skulls are plastic skulls. But right here, I've got my lacrimal bone, and that's where I'd have my lacrimal duct or my tear ducts. So the answer to 172 is the lacrimal bone. That's why oftentimes they tell you, if you touch a surface or shake hands with someone, you don't want to touch your eye, because that's the most common place through that duct that you can actually enter the sinus and pass any kind of sinus infection or any type of virus or any type of fungus or any type of bacteria. 173 says open spaces into concentric rings. Again, we're talking about the microscopic anatomy that I started out with on this lecture. Those are going to be the lacunae. Bones making up the hard palate, number 174. Well, if I look at the roof of my mouth, that's the hard palate. If I look at my hard palate, I'm going to literally have 4 bones making up. So those bones that make up my hard palate are going to be the bones toward the front and the bones toward the back. These are going to be the maxilla, and these are going to be the palatine. So therefore, I've got 1, 2 maxilla, 1, 2 palatine bones. I've got 4 bones that are going to make up the hard palate. 2 maxilla, 2 palatine, and of course they're interconnected by sutures. They're immovable joints. Again, what's the significance? If I had a child where the maxilla did not fuse, I'd have a cleft lip. So unfused maxilla, unfused leads to cleft lip. If I had a child that the palatine bones didn't fuse, that's going to lead to unfused again. But that's going to be an unfused palate, so a cleft palate. So children could have a cleft palate, they could have a cleft lip, or oftentimes they have both a cleft lip and a cleft palate. So it's not an uncommon pathology in children, and that very easily fixed, but it takes a very, probably an oral maxillary facial surgeon to do it. 175. 175 says loss of bone mass. That's going to be osteoporosis or osteopenia. 176. 176 scan for loss of bone mass. That's going to be called a DEXA scan. 177, unarticulated appendicular bones. Remember, appendicular is going to be my appendages. There's only 2 bones that are unarticulated, and again, that's going to be my patella. 2 patella. 178. 178 says type of bones in 177. Well, the patella member are going to be sesamoid bones. They're going to be tendon bones. That's where the tendons, again, are going to pass for the quads and allow for leg extension. 179. 179 says unarticulated axial bone. That's going to be the hyoid. That's going to be in the axial skeleton. It's actually the bone that's going to be for stabilization of the throat muscles. It's actually going to be an attachment for the tongue, and you're going to see the supra and infrahyoid muscle attachments.